views. So this is the first coronal view, where the probe, you're cutting the probe at the frontal cortex. This is a frontal cortex you're cutting here. So look here. This way you're cutting. This red line is the first view which I am going to show. This is cutting the frontal cortex and the orbit. So this picture you get on your ultrasound. This is an interhemispheric fissure. This is a white matter on the both sides. These are the frontal lobes. This hyperechogenic line which you are seeing is the cranium. And this is the orbital fossa. The second plane we go sweep little posteriorly. From the anterior, you move towards the posterior side. So you cut through the frontal horn of the lateral ventricle. See, here is the frontal horn of the lateral ventricle. You are cutting the section through the frontal horns. This is a picture you get, and I'll describe you what all we can see. This is an interhemispheric fissure. You can see the lateral ventricles. This is a corpus callosum. And this anechoic area is called as cavum septum pellucidum. This Y kind of fissure is the Sylvian fissure. Here is the frontal lobes, and here you can even see the temporal lobes. Going to the third plane in the coronal view, look this is a third plane where you are cutting through the foramen of Monro. This is also called as mid-ventricular view. This is again the third view in the coronal sections. So this is how the picture you see. Again, this is the interhemispheric fissure. These are the frontal lobes. This is a corpus callosum, and this anechoic area is the cavum septum pellucidum. These lateral black area or the anechoic area are the body of the lateral ventricles. And then just beside this is the caudate nucleus, then is the thalamus. This again, when you go down, these are the third ventricles. Foramen of Monro opens up into the third ventricle, and you have laterally the internal capsule. And when you go below, these are the pons and the medulla. So this is how you, in the mid-ventricular, I just highlighted the caudate. These are the lateral ventricles I showed you. These are the caudate nucleus, and this is the thalamus. This is the foramen of Monro. So the next plane, we go little posteriorly, and this is a fourth plane which is posterior to the foramen of Monro. This picture you find, and in this again you can see interhemispheric fissure. This is a corpus callosum. You can see the Sylvian fissure. You can see the cerebellum here. The beauty of this is that here you can see the cerebellum and the cisterna magnum. Then when you go more posteriorly, see this is a lateral ventricle. This is a trigone of the lateral ventricle. So you're cutting through the trigone of the lateral ventricle. And these echogenic, hyperechogenic white areas which you see are normal. And these are called as choroid plexus. And in between here you have the corpus callosum. This is a trigone view. So next is the occipital cortex view, which you are cutting this section posteriorly. When you go the most posteriorly, you will get the occipital cortex. This red line is showing how you are cutting the occipital cortex. And here you can see the white matter, periventricular white matter, the parietal lobes and the occipital lobes are seen. And this midline line is a echogenic line is a interhemispheric picture. Mainly you get the periventricular white matter in this picture.